And I think with women's health it's challenging because women have also been marginalized. Then you have mental health marginalized. So you have this sort of double effect. And then if you add other forms of oppression onto that, it gets really challenging. We can all do something by, the relationships that we have, by banding together and doing things. And we can also, we can each do something by being honest with ourselves and our colleagues and our friends about our own personal experiences. I've had my own mental health struggles, my family has. And when I went through those, I had to decide, how am I going to approach this? Am I going to walk the walk and talk about this? Or am I going to, keep my professional suit of armor on? And I think we can all make a difference by being honest about these things and being open about it. And we can't underestimate how powerful it is. And that's something we can all do without, it's very doable for us to do that on an everyday basis. The other thing that I think is really important is when we think about mental health care, we're in an emergency. People often say a crisis. I would describe it as emergency. We've been in a crisis in this country for decades with mental health. We've ignored it, and now it's an emergency. And there will never, unfortunately, be enough mental health providers to see the patients that need one, whether it's psychiatrists or therapists. It's never going to happen in any of our lifetimes, no matter how much we train people. So we need to think more upstream. So we need to think about, how do we stop transgenerational trauma, transgenerational transmission of mental health challenges? And we can do that by building and promoting resilient families, and by focusing really early, having policies that support children and support parents of children and support parenting, and really focusing on the perinatal time period and on young children, and also thinking about that in a relational health way. So we're supporting a parent and child dyad, and we're doing that as early as possible. I personally think that our biggest chance of making an impact in our mental health emergency is not by, yes, we do need to build more hospitals, people need meds. All those approaches are very reactive. We need to be more proactive, and we need to think upstream, and rather than only focusing downstream and reacting to, once someone has really complicated illness, and preventing that by supporting families and supporting resilient families that have the capacity to support their children's mental health.